Hello, my name is Dr. Amelia Hollywood. I'm a lecturer in health services research and a health psychologist. I'm going to be delivering a lecture on the multidisciplinary team, and this content will feed into the workshop on the same topic that you will be having later in the week.
As with most of your lectures, at the beginning we'll outline the aims and objectives so you know what to expect in the coming session. So for this lecture, I'm going to be providing you with an introduction to the multidisciplinary team and its importance in successful patient care. And then we go on to some more specific objectives. So hopefully you'll be able to define what is a multidisciplinary team, list the professionals that commonly form an MDT and describe some of their roles and responsibilities, identify and explain the benefits of an MDT to patient care, and then go on to suggest suitable members that should form an MDT for a particular patient. You'll also hopefully be able to then go on to be able to signpost to different professionals depending on the patient that presents to you, whether you're in community or hospital setting. So this is another explanation of the overview. So what you're going to learn is what is a multidisciplinary team. We'll identify why that's important. So why is a multidisciplinary team important? And then look at identifying the roles, education and regulations of the various different disciplines that might form a team that you work in. So firstly, let's discuss some of the characteristics of a team. So essentially, it's a group of individuals who work together to produce or deliver services. So usually they have shared goals. The team relies on each other to achieve those goals, and the results are affected by the interactions with one another. A team is held collectively accountable. So that means it's the responsibility of each member to work effectively with one another. So a multidisciplinary team is a group of health professionals with expertise in a specific discipline, and together they discuss and manage an individual's patient care. Within PM1C, you're quite lucky, you are taught by a multidisciplinary team. We have pharmacists, both community, hospital and GP based. And then also you have people like myself, I'm a health psychologist. So you get a very much a multidisciplinary approach to your learning, which then helps you in terms of your practice once you complete your MPharm degree and you go out into the world of work. So some benefits for the patient of being treated by a multidisciplinary team. There are improved health delivery. It gives them access to a wider range of expertise, and also there's more specialised and holistic care. There's also benefits to staff. It can promote ownership of tasks, tasks get delegated, which means you can develop roles. It also allows development of knowledge and skills. It can also be quite motivating. I know for myself, working amongst more of a multidisciplinary team has definitely motivated me and also helped me in my own development. So working as part of a multidisciplinary team, either in a learning environment such as universities or when you're out in hospitals, there's huge benefits to everyone involved. And there's also better use of resources, so it ends up being quite a cost-effective service within a healthcare service. So signposting is really important as a pharmacist and something that you're likely to do whichever setting you're in. So it involves referring a patient or carer to an appropriate professional or service. It's an essential service for community pharmacies. It's important to know what others can offer. So you know your own limits, you know what you can and can't do, and then you can signpost your patients to people that might be able to support them and help with their care. Need to be aware of availability of various resources and services, especially when you're in community. So you don't want to be signposting to people to a service that doesn't necessarily exist or isn't funded in your area. So other benefits of the MDT. A good teamwork can make a critical contribution to effectiveness and innovation in healthcare delivery and contributes to members' well-being. So that's a useful quote there to show some of the benefits. So there are some barriers to an effective MDT. Historically, power relations can be a hindrance. So in some Historically, the doctor would have been seen at the top of the pile, and those power dynamics may cause issues when trying to work as part of a team. Separate and different education and training of the professional groups can lead to potentially strong perceptions of one another. Sometimes that can be negative. It might be different culture, language, behaviour. I definitely experienced that coming into pharmacy from a psychology point of view. Just the language that we use in everyday and our everyday practice is different, so you just need to be aware of that. There may be some misunderstandings or clarifications required. And then there's distinct professional boundaries, including identity and status. That could be a barrier to effective MDT. So there's also different organisational structures, contractual obligations and physical presence that could be a hindrance. And then I guess one of the key points is poor communication. So an MDT is most effective when everyone communicates effectively. So that's a really important factor to consider. So what makes a good team? So we've got some elements up here to consider. Clear objectives, effective decision making, conflict management, that's really important. Being able to diffuse any situations if they arise, but then also be preemptive. So being aware of what could lead to conflict and building something in place to avoid that in the first place. Engagement is important as well. Good leadership, mutual support, good communication, as I've already mentioned, and commitment to quality. So I just want you to just take a moment and think, who do you know? Who can you think of who's a healthcare professional? What are the different professions you're aware of? Maybe if you've got a piece of paper nearby, just jot them down. Who have you interacted with on a personal level? Maybe you've done placements. Maybe you have friends or family members that are healthcare professionals, so you're aware of those as well. Okay, so now I'm going to introduce you to a potential team that would be treating a patient. First up, we've got the doctor. So let's have a look. So they are regulated by the General Medical Council, the GMC, and then they have a professional body who looks after them in their profession, and that's called the British Medical Association, so the BMA. So that's who they're regulated by, and that's who their professional body is who represent them. So doctors go through a full training program. They do a 5-year degree, a 2-year foundation program, which leads to full registration after year 1. And then you have the specialist training, which goes 3 to 8 years, depending on their specialism. Next up, we have the nurse. They're regulated by the Nursing and Midwifery Council, and their professional body is the Royal College of Nursing. So again, they have a full training program, and they complete 3 years of a BSc or a 4-year MSc. At least half of their training must be in a clinical setting. And then they get registered with the NMC, so the Nursing Midwifery Council. Then we have the nursing assistant, also known as nursing auxiliaries or healthcare assistants. They are not regulated. They do not need specific training, but often complete an MVQ, level 2 or 3 in healthcare support. Then we have the occupational therapist. They are regulated by the Health and Care Professions Council, HCPC, and their professional body is the British Association of OTs. So they're both regulated and have a professional body. So they complete a 3-year BSc or 4-year MSc, and then they achieve registration with the HCPC. The physiotherapists are regulated by the HCPC as well, and their professional body is the Chartered Society of Physiotherapy. Again, they complete a 3-year BSc or 4-year MSc and then achieve registration with the HCPC. And then we have the pharmacy team. So I'm now going to run you through a couple of roles that you might not be that familiar with. So there's the pharmacy technicians. They're regulated by their GPHC. They must complete NVQ Level 3 Pharmacy Service Skills and have underpinning knowledge, for example, BTEC in Pharm Science. They can also take part in post-qualification training. So you have ACT, ACT, which is Accuracy Checking Technician, MMT, which is Medicines Management Technician, and then Technical Services, like aseptics. And then you have pharmacy assistants. So they're not regulated, but they must complete units of NVQ Level 2 Pharmacy Service Skills relevant to their role. And they may be offered the opportunity to study for BTEC Level 2 in Pharmaceutical Science. So now I'm going to talk you through a patient case study. So it's kind of the why behind this lecture. So I've told you what an MDT is, and now we're going to talk about why an MDT is important from a patient's perspective. As healthcare professionals, whether pharmacists or psychologists, patients are always at the centre of our care. So we need to embed that within our teaching that we deliver to you so that you can then embed that in your practice as a pharmacist. So I'm going to introduce you to Mr. Hughes. He was admitted to hospital with right-sided weakness and slurred speech. He was diagnosed with a stroke. So let's have a look at some of the MDT that might be involved in his care. So there may be a nurse, a doctor, a physio, an OT, occupational therapist, SALT, which is speech and language therapist, and then there's the pharmacist. So both while he's in hospital, he may be interacting with a pharmacist, and then when he's discharged and goes home, he may have medication to take that he'll then need to interact with the community pharmacist. So you can see here that it's not just one healthcare professional's responsibility to look after him, because he wouldn't get the best care. It's a multidisciplinary team that's involved to make sure he gets the best outcomes. So just to remind you, the objectives of this lecture were to define a multidisciplinary team, list professionals commonly involved in MDTs and describe their roles, responsibilities and education, explain the benefits of the MDT to the patient care, and then suggesting suitable members of an MDT for the care of an individual patient. And then we also spoke about signposting and how important that is as your role as a pharmacist.
Thank you for listening to this lecture on the multidisciplinary team. Hopefully it's provided you with insight into how pharmacists work and who they work alongside. If you have any questions on this material, please write them down and bring them along with you to the workshop. At the beginning of the session, I will ask if anyone has any questions, and then we can have a group discussion.
What do you like most about your work?
I like the patients. The patients are the best thing. I like talking to them, hearing their stories, and hopefully making a difference and getting them out of hospital as quickly as possible, feeling better.
Describe some of the challenges you encounter in your role.
The patients. They're often quite challenging, and a lot of my job is about trying to make them understand what we think is wrong with them, and to try and get them to comply with what medications or treatments we offer.